I am very honored and excited to introduce Mary Conroy-Johnson, who is one of the co-founders with her husband of the Free Clinic of Pierce in St. Croix County. And this is a group that I am very passionate about because I worked with Pierce County Health Department for 23 years. And when this idea came forward and came about, it was so nice to refer people to someplace that wasn't Menominee or in the Twin Cities somewhere. Because if you can't afford health care, you don't have much transportation either. So I'm very honored to introduce you to Mary Conroy-Johnson, whose husband is Dr. Bob Johnson. And I have their most recent newsletter here that I could share with you, but I also have some other information, Mary.
Okay, thank you. Thank you for having me. Janet's passing around our fact sheet, and I'm not going to go over the facts. You can read them, but they're very interesting. What I can tell you is we've been open for 11 and a half years, and it was a very simple concept idea that I had. My poor husband, I came in one day and said, hey, I have an idea. And he's like, what now? But anyways, what we did is we copied Menominee, already had a free clinic, and we went there and we didn't reinvent the wheel. We are open one night a week, just like most free clinics. And our mission is to provide primary health care. That means we aren't going to do deep psych, we aren't going to do pain management. We're not doing anything that we can't handle in a very minimalistic kind of clinic setting, and provide the medications that are associated with the diagnoses that patients have. The first year we were open, a week, and actually quite frequently since, and Jen does the intake so she can tell you, we have many patients that have open heart surgery and do not buy any of their medications afterwards because they can't afford them. We have diabetics that take a small insulin thing and water it down or reuse needles all the time. And it's just a crime. It bothers me to no end to think that people in this United States of America still have to beg for medications. We're open one night a week. We see up to 25 patients each night if we have that many that need to be seen. We evaluate them for their job and their income. We have three criteria. They have to live in Pierce in St. Croix County, a certain low income level, and not have any other health care alternative. By that I mean if we find out a veteran's there, for example, they can go to veterans. Now that sounds like we kick people out. We don't. We will still see them. I say we kind of present the full meal deal. We will refer them to other counties if they're from Dunn County or Red Wing or someplace, because there's free clinics in many areas. The two main things that we do not take care of that is a serious need across the board in any level of health care, and that's dental care and heavy psych care. And by that I mean we can take care of a simple depression if someone's having trouble sleeping or minor anxiety. And the wonderful thing is they don't have to pay for any of it. On the very bottom of this sheet, you can see that, maybe it's not on this one, yes it is, $566,000 worth of medications we gave last year. And that's our retail value. We gave out over $750,000 in medications last year at retail value. Now we have lots of ways to kind of get around some of that, so it's wonderful. We're very cheap. Squeaky. But we have, every day we have physicians on, we have nurses on, we have pharmacists on, we have pharmacy tech people, we have social workers, we have many, many Mexicans that come. So we have usually one Spanish translator, sometimes up to 3. We have about 25 volunteers every Tuesday night. And then we have many volunteers that throughout the week that help us with paperwork. We have 2 staff people at this time. We have Mary Steele from River Falls, and she's our clinic manager. And Gina Most, I think you know the Most family. Yeah. Betty Most's daughter is our nurse, clinical nurse. And she's wonderful. as you all know the most. But they are 2 hired staff. We also have someone that we pay a minimal amount to do our dictation, because we have to charge some people so that we can do continuing care. And we also have a small bookkeeper that helps us with our bills. So I'm not good at that, and I have a good mouth, but I'm not good with the money. So I know my strengths, or my weaknesses, more important. It's housed in River Falls, so a lot of people think it's a River Falls medical free clinic. It is not. As you can see, it's much more St. Croix County than Pierce County, which is something I thought when we opened it was going to be probably more Pierce County. I mean Pierce, I don't know. But St. Croix is much heavier. It's almost, it is a double finger. I mean, it's usually 13 to 15% more St. Croix. It's equally men and women, which is something. And the age difference, you know, Badger Care has expanded a couple of years ago. That really helped, especially single young men. And we don't see children, of course, because they can get Badger Care. We don't see anybody over 65 because they, you know, we have, but it's a pretty condensed age bracket. The cares that we take care of primarily are what are probably the number 5 things that are in any medical clinic. High blood pressure, probably diabetes is quite high. We have quite a bit of diabetics. Depression, you know, minor depression, and I mean, these people have overwhelming social needs, and not necessarily social, but I mean, you know, they can't pay their car bills, they need new tires on their car, they need to pay for lunch for their kids at school. I mean, there's so many things, and then they get a disease like diabetes, which the average diabetic takes about 8 medications related to diabetes, whether it's high blood pressure, cholesterol, whatever. I mean, it's amazing. I will say, and this is not a political statement, Obamacare helped our patients, the patients that we see. First of all, they get Obamacare, and they can see a doctor when they need to, not just Tuesday night. You know, hard to schedule being sick, you know, just for Tuesdays. But we also have somebody available at least one person every night on Tuesday night that is very computer savvy, that will help anybody get on Badger Care, or when the marketplace is open for Obamacare. Because first of all, they don't have computers. Secondly, they don't know how to navigate through a computer. And third, we found something that was a very big eye-opener for me. A lot of them don't even know the lingo. What's a copay? What does that mean? I mean, every time I come, I have to give them, you know, I mean, the things that, you know, that you and I are blessed with, either having some insurance through our job, or because traditionally your family always had health insurance, so you have some of that lingo. You know, it's just so we're very blessed. We have about over 100 volunteers, and that come, and they told us in Menominee, do not let a volunteer come more than once every 6 weeks, they'll get burnt out. Oh my God, right, Janet? If I told Lee Hill or Betty Lou they couldn't come every week, I'd have a revolt. I mean, I have some people, and they hardly knew each other to start. And now they're best friends. They go out to lunch, they exchange books, they exchange recipes, they all know each other's grandkids. It's a family, and it's wonderful. We get doctors and nurses and all volunteers from all over the 2 counties, so that's really wonderful. Right now we're really focusing on Hudson for fundraising because they aren't helping as much as we would like. How's that? Did I do that politically okay? Oh my God, it's on tape. But it's the truth, you know. I mean, it's just amazing that, you know, I think one of the things that you guys know this because Prescott too has got a heart and a spirit of its own. You know, many communities in western Wisconsin, River Falls, Bob and I, when we decided to do this in 24 hours, we decided we were going to do this. Within a year, our door was open. Now that's impossible. I mean, with grants and people, and every single person I asked to be on the steering committee said yes, except for one. Actually, since I started this project, only one person has said no to me, and that's because his wife was very ill. Joe Bowles called me, don't you dare say no to Mary. You know, I am the oldest of 11 11 children, and my mom and dad told me I had to be bossy. So my nickname in the family is Bossy Mary. And believe me, I live up to it. But it's good for your heart, it's good for your soul. And I know everybody in this room probably has a relative, a neighbor, somebody in their church, someone they see in the grocery store a lot that you look at them and you know that they're not taking good care of themselves. Please refer them to us. We have a box, Jan, the black box, this big, and it has 1 million brochures in it. If somebody wants to quit smoking, if they want to lose weight, if they need fuel assistance, if they haven't had a pap, females that haven't had pap smears, I mean, it goes on and on and on. Now, we can't guarantee that they're going to be seen, but we can give them numbers and reference and coach them. Say, hey, this is important to your health, and Dr. Johnson will be really mad at you if you don't do it. It's nice to be able to say that. No. So go ahead, Janet.
The reason I do intake instead of nursing, because I'm a retired nurse, is that I know the resources.
Yeah.
And one of the things I've always told people, I can't pay your medical benefits, but we can give you references to other things, like the food shelf.
Yeah.
And both Pierce and Croix County have wonderful free meals and everything available. And people are just like, really, that's available? And I think that's something that we never realized, that how other people just don't know what's up there.
They don't.
They don't know where to go for it. So it's been wonderful.
So thank you for thinking of us, and we're having a big gala November 10th at River Falls Golf Course, our annual big push, and it's going to be we usually do a talent show, and we're doing more of a evening of hors d'oeuvres and music and kind of seeing how that goes, just
fun.
So, huh?
A fun night.
It's $25. It's a little bit higher than we had in the past, but we thought it's kind of classy. It's kind of heavy hors d'oeuvres and the dessert and music. So if you can put that on your calendar, we'd love to see you. If you want our newsletter, I should have it here. I'll put this piece of paper. I'll put your name and address on it, and we'll send it to get you on our list. We have a newsletter twice a year, and we usually have an outreach thing at the end of the year for our end of year. But we write grants, but grants are kind of going in every nonprofit. They're getting narrower and narrower, and we don't add any services because we have enough services that we provide. And most grants want, what new services? What are you going to do new now? And so that's difficult for us. And we're just maintaining, and we are still plenty busy, and as you can see, like I said, we see about 25 patients a night, if that many want, but we see up to 30 more that come in for dressing changes or high blood pressure checks or refills. And it's a busy place. It's a fun, hopping place. So,
Mary, do you,
any questions?
your doctors and nurses that work there on Tuesday night, are they all volunteering their time?
Everybody volunteers their time except for the two staff and the bookkeeper and the dictation.
About how many different, like doctors do you have and nurses that you have, medical people?
Per night?
Like when they come on the Tuesday night, how many?
We usually have 3 all the time because we always had 25 patients.
3 doctors?
Now we're down to 2.
2 doctors?
Yes, per our healthcare provider, we have physician's assistants and nurse practitioners. And my husband's a medical director, and he's there every Tuesday night. And so he kind of oversees everybody's care, and he meets with our nurse, Gina, once or twice a week to get all the blood work out to them and recommendations and prescriptions and radiology. We have free radiology and free lab work too. I mean, that's from Alina. So bless you, Alina. Up to $10,000 a year they will do for us, and we never get there.
Wow.
Because we're so good at taking care of our patients.
What are the hours that you're open on Tuesday?
The door opens at 4:15, and then we're open till 8.
Okay. So if there were maybe 35 or 40, then some of them can't be served when you come.
But in the beginning we did, and we always gave them a priority number for the following week. But we've never had to implement that in the last year, or the last couple of years, because Badger Care expanded, and Obamacare, and I'd like to think that we got some people so healthy they don't need us, man. But we also see people that, fall and break an arm, and so it's acute care more, and.
How many years? I know it started, it hasn't been that long since
Yeah,
we've had
11
it.
and a half.
Oh, 11 years already.
Yes.
Yeah, well, we sure do thank you because it's such a neat.
I sleep better at night,
Thanks. Yeah,
knowing
well.
that some of my neighbors are, getting care. It's really good for your heart, isn't it, Janet?
And is it at the
Yes,
River
it's
Falls?
Where does your
River
funding
Falls
come from? You
Hospital.
said you spent a lot of money on
hospitals.
prescriptions and
Yes.
so forth. but what-
Primarily private donations.
Okay.
Secondly, I would say grants. And thirdly, service groups and churches. And then we have this list of people that honestly give us money.
No government funds?
No, we had one, I got one grant for $150,000 in the very beginning. I don't know what they call that, what do they call that when you?
Startup.
No, I don't know. It's not a nice name. But anyways, well, I shouldn't say that. You know what when they call it when the politicians get their little pet projects through? Corridors. Thank you. Well, I didn't know that when I applied for it. I just went to speak to a group like this, and someone in the group said, "Hey, Ron Kind has got an in for some stuff," and we got $150,000. So that was wonderful. So we got computers and
Like
oximeters and stethoscopes and So, but it's primarily, we get a lot of service groups that will specifically say, we really need thermometers, and it's just, we've been really well received. Well, we don't provide transportation, which is something that bothers a lot of people, but we tried it for a little while, and people wouldn't show up, they wouldn't come. So then we found a couple churches around the area that if you're there by a certain time, they would transport. Well, people still didn't come. Our patients find each other and help each other a lot. And I help 3 other free clinics start, and I tell them, if you build it, they will come. I believe that. They'll find a way, because everybody wants good health. Everybody wants to be able to get up in the morning and feed their children and go to their children's plays and go to their work. So, that motivation of just doing something for yourself. And many of our patients love it. Go ahead, Janet. I'm sorry.
The prescription
Yeah.
assistance program.
What?
And
Yeah, well, I didn't bring, that's part of, it's a lot.
Well, there's a way that they
If
have.
there's a really expensive medication, for example, what's a quit smoking one? I can't think of it. What?
Genetics.
Yeah, it's really expensive, and we don't, our formulary is very small, the cheaper things, because that's all we can give. But if somebody, for example, we had one gentleman, for example, had seizures, a very serious seizure disorder, and only one medication helped him. It was way too expensive. So the drug companies, I'm sure you've seen commercials say, if you call 1-800, Merck will help you. Well, you should see the forms for one. So we have people there, like Janet said, every week that can help fill out those forms. And so we get quite a few medications free from the drug companies. But they're making it harder and harder too. They do stuff like only in blue ink, only in black ink. It's amazing.
Do the pharmaceutical companies give you samples or anything?
Well, we used to, but most places don't accept them anymore. Or most drug companies, I don't know if anybody works in that industry, they cannot give them out anymore. There's so much restrictions on the drug companies now. We used to do tons. And when Alina and a couple other places quit accepting samples, they would take them in and drive them across the border and give them to us. Well, now there's hardly any samples in the drug companies anymore. The drug companies really have been clamped down on. Been really, really difficult. I don't know if a few of you look old enough to be about my age, where I can remember I go to the doctor and sometimes he'd just bring a little brown paper bag out and say, here, take this for 4 days, and give you the samples. No such thing anymore. So it's really impacts our.
One of the things the drug companies do for us is feed us.
Yeah, exactly.
Feed you?
Well, when
Every
we come
Tuesday
there,
night- every Tuesday night we have-
Tuesday night gives them an opportunity to talk to our physicians, and they feed us really well. Because they come from all over.
Yeah.
It's nice to be able to get there on time and be able to have a meal and.
Sure.
Well, most everyone that comes to volunteers worked all day.
Yeah.
So we figured the least we could do is feed them.
Where is it physically located again?
River Falls, Vibrant Health.
Health.
Vibrant Health, where's that?
River
It used to
Falls
be River
Medical
Falls
Clinic.
Medical Clinic, it's
Oh,
Vibrant Health. They have a unit that closes at 5, one unit, and we
is
use
that
that.
near the hospital, where is it located?
It's attached to the hospital.
Attached to.
There's a separate entrance around
Okay.
inside so people know where to come, because they're initially screened, because one other thing they do is give them a number with a complex number or a basic, so that we know
Yeah,
if
exactly.
somebody's really
Exactly.
sick, that they get
Well,
to
we
see
get,
right away.
what, it's what you do in a regular clinic.
Right,
I'm,
yeah,
I'm
triage.
an old intensive care nurse, so we triage. I mean, believe me, I've pushed people in a wheelchair right over to the ER. In fact, we had one just 2 months ago, and he told me I could tell the story, so I'm not breaking any HIPAA laws. He was having chest pain. I pushed him over to the ER. His EKG was awful. The helicopter was there. He went to United, and he was in the heart cath lab in about 20 minutes and had about 4 stints. His wife came in the next week with cookies for us, so very nice.
Very nice.
But I mean, you know, so, you know, having the hospital right there is wonderful. And the radiology right there, and the lab right there, because we can do it all. And the emergency room at first used to think that we were kind of dumping on them. I worked there for 23 years and I finally said, do I look like a dumper? No, I finally just, I had to talk with them and explain to them what we did, and then, now they're totally part of the team. So if I wheel over there with a chart and a patient, it's, you know, total cooperation, Alina and Vibrant Health and the 3 founding fathers were the Kinnickinnick Health and Education Foundation, which I was president of at the time, which is now the River Falls Foundation. River Falls Medical Clinic, which is now Vibrant Health, and River Falls Area Hospital. They all said yes immediately, get it done. Thank God for them, because really, nowadays it'd be much harder, believe me. So, any questions? Sorry.
I think, Mary, one of the reasons I asked Mary to come talk is that I feel like Prescott's underrepresented. We're kind of part of mini-Wisconsin, and so many people work in Minnesota, and I don't think it's known that it's out there.
And part of it is, and I don't mean this as anything except for your health base is Alina.
And it's
So-
Minnesota.
Which is fine, you know, I mean, that's great, I love Alina, they've been wonderful to us. But, you know, like, we get a lot of patients, of course, from Ellsworth, because there's a big presence there. A lot of patients from Spring Valley, because there's a big presence there, and, you know, and the doctors that go to, that from Hudson and Baldwin and New Richmond, you know, so it's just awareness, as you said,
Yeah.
you know.
So that's,
We're here. Send them to us.
if you
Tuesday
can't
night.
remember how to get anybody there, call me.
Yeah, it's wonderful.
Thank you.
Thank you.